All right, welcome to the deep dive. Today, we're taking a deep dive into something I think just about all of us have some experience with, fever. But we're going to do it a little bit differently.
Yeah.
Rather than thinking of fever as just a symptom of being sick, we're going to look at it for what it really is. Your body's actually a pretty clever defense strategy,
That's right.
kind of kicking into overdrive. So we've pulled a lot of information for this from the biology, like how it works, to, what experts are saying about when and how we should respond to it.
Right.
And, as a listener, you've probably had your own moments of wondering about fever, like when should you be worried? When is it okay to just treat it? What's actually going on in there?
Yeah.
And that's exactly what we're here to break down. So this is kind of like your shortcut to understanding this whole fever thing.
Yeah, this isn't about memorizing some magic number on the thermometer. It's really about understanding how our bodies are made to protect us. So we're going to start with just a basic definition of what a fever is.
Okay.
And then we'll go into, all those amazing things that happen when your temperature rises. And then we'll look at the controversy about whether we should be suppressing fever at all. We'll look at some specific considerations for children and some less common reasons why your body's internal thermostat might get turned up.
Okay, so let's start right at the beginning then. What is a fever?
So a fever, which is also called pyrexia, is a natural, it's an innate immune response. It's your body's reaction when it senses it's being invaded by these unwelcome guests that we call pathogens, like viruses, bacteria, and the amazing thing is that this isn't limited to humans.
Right.
The evidence suggests that even animals experience fever.
Wow.
And this protective response is estimated to have been around for 4 million years.
4 million years. That's incredible. So it's clearly a very deeply ingrained part of our biology. You mentioned something though called fever phobia. What is that?
Yeah, fever phobia is a term that describes, this common and widespread fear that fever is always dangerous and something to be stopped immediately.
Right.
But really, as our sources point out, fever is often a sign that your body is actively fighting off an infection.
Okay, so before things start to heat up, what's the normal temperature range we should be aware of?
So generally, your normal body temperature is going to be somewhere between 36.5 and 37.5 degrees Celsius.
Oh, okay.
Now, there's not like one exact degree that suddenly makes it a fever, but pyrexia, which is a fever, is usually defined as a core body temperature of 38 degrees Celsius or higher.
Okay.
And it's important to remember here that we're talking about core body temperature.
Right.
Not just your skin temperature, which can change, if you're in a hot room or something like that.
Yeah. When does a fever kind of move into the more concerning, levels?
So if your core body temperature goes above 40 degrees Celsius, that's called hyperpyrexia.
Okay.
And that can happen with things like, the flu, the common cold, but also more serious infections like pneumonia, tonsillitis, kidney and prostate infections, bacterial infections. Even things like malaria can cause these very high fevers that go up and down.
Now, is hyperpyrexia, is that the same thing as like if somebody, gets way too overheated in the sun or they have a heat stroke?
Yeah, that's a really important distinction.
Okay.
So hyperpyrexia is what we've been talking about, which is really your body's internal response to an illness. Hyperthermia is when your temperature goes up because of external factors, like if you get heat stroke from being out in the sun too long or even from doing really strenuous physical work.
Got it.
And hyperthermia can be dangerous because that's when your body can't regulate its temperature properly. But just as a side note, it's interesting that controlled hyperthermia is actually being used now as a therapy for some conditions, like certain types of tumors.
That's fascinating. That's really using heat to treat something. So if we think we might have a fever, how can we be sure that we're getting an accurate reading? There's so many different ways to take your temperature now.
Yeah, you're right. There's a lot of ways. There's, the axillary, under the arm, oral in your mouth. You can get forehead strips. There's auricular in the ear and rectal. And our sources say that the most accurate way to get your core body temperature is to use a digital thermometer rectally.
Okay.
Because that gives you the closest reading to your actual core body temperature. Those under-the-arm measurements or on the forehead, they can be a bit less precise.
Got it.
And so you might not get a true reading.
Okay, so rectal is the most accurate. What about those ear thermometers? A lot of people find this really convenient.
Yeah, if taking a rectal measurement isn't comfortable for you, then an ear thermometer is generally considered the next best option.
Okay.
But it's important to remember that no matter which method you use, your core body temperature actually changes throughout the day. It fluctuates naturally by, to 1 degree Celsius.
Oh, okay.
And it's usually a bit higher in the evening than it is in the morning.
That makes sense. Our bodies have those, those daily rhythms. So the pathogens get in, the temperature goes up. But what's actually happening inside us that causes this increase in temperature?
So when, those unwelcome guests, those pathogens like viruses or bacteria get into your body, your immune system is immediately triggered.
Mm-hmm.
And it starts to put up its defenses. And so these special immune cells release these fever-inducing molecules called pyrogens.
Okay.
And what's interesting is that the pyrogens can also be parts of the pathogens themselves.
So these pyrogens are kind of like the warning signals, like the alarm bells going off, in the body.
Yeah, or maybe more like messengers.
Okay.
They're not really the troublemakers themselves, but they're carrying this important message. And so these pyrogens, they travel through your bloodstream to a part of your brain called the hypothalamus.
Right, the hypothalamus.
And the hypothalamus is really important because it controls a lot of essential functions in your body, like breathing and circulation. And it also contains your body's thermoregulation center. That's basically your internal thermostat.
Mm.
And so the pyrogens basically talk to the hypothalamus and they tell it, hey, turn up the heat,
Right.
Raise the body's target temperature. And so this then triggers the release of other signaling molecules called prostaglandins.
Prostaglandins, I've heard that term before. It's often associated with pain and inflammation, right? So what role do they play in this whole fever process?
So they play a key role in actually causing your body temperature to go up. So they send signals to your muscles, and that causes them to contract rapidly, which is what we experience as shivering.
Oh.
And that shivering generates heat.
Right.
And at the same time, your blood vessels near the surface of your skin constrict.
Mm-hmm.
They narrow, and that helps to conserve heat and prevent it from escaping. So that's why you feel cold. You might even have chills, especially at the beginning of a fever.
Mm-hmm.
And this phase is called the stadium incrementi.
Ah, so that explains the chills. So it's not just that your temperature is going up, your body's actually making these changes to conserve the heat as well.
Exactly. And this is just the first act. It's like a 3-act play.
Mm.
You have the warm-up, the main fight, and the cool-down.
Interesting. So once the body temperature has reached this new set point, what happens then?
So once your body temperature has risen to that new level that the hypothalamus set, those blood vessels near your skin, they dilate again. That means they open up, and this increased blood flow helps to deliver those immune cells to the site of the infection more quickly.
Mm-hmm.
And the higher temperature itself actually makes it harder for a lot of those pathogens, those invaders, to multiply.
Wow.
So they can't spread as easily. And this phase of the fever is called the stadium fastigium.
Okay.
So your body's basically turned up the heat to make things uncomfortable for those invaders.
Right.
And to help those immune cells do their job.
So what happens when the threat has kind of been dealt with? What happens when the fever breaks?
So when your immune system has done its job and it's fought off those pathogens,
Mm-hmm.
the hypothalamus gets the signal to reset the body temperature back to its normal range.
Okay.
And those blood vessels near your skin, they stay dilated to help release that excess heat,
Okay.
which leads to sweating.
Right.
And that's when you feel like you want to cool down.
Mm-hmm.
And this phase is called the stadium decremente.
So the fever decline, and all of this from the beginning to the end, it's pretty energy intensive for your body.
Absolutely. That's why you feel so weak and tired when you have a fever.
Yeah, absolutely. It's pretty remarkable, that this whole process it's incredibly well coordinated.
Yeah.
It's fascinating. Now it's interesting the article mentioned that not all infections lead to this full-blown, super high fever.
Right. Sometimes a milder increase in temperature, which we call a subfebrile temperature,
Yeah.
that's enough for your body to deal with a less serious infection, like
Right.
a common cold.
Okay. So this brings us to kind of a really big question that I think a lot of us have probably wrestled with.
Yeah.
Should we even be trying to treat a fever?
Right.
Like there seems to be some debate about that.
Yeah, there's really two main perspectives on this.
Okay.
One viewpoint, which is pretty strongly supported by some of the sources we looked at, is that fever is a protective mechanism that's been around for a long time.
Mm-hmm.
And it has a purpose, and therefore we shouldn't be so quick to try to suppress it artificially with medications.
Okay.
The other viewpoint is that, having a very high temperature, especially if you're already weak from being sick or if you have other health problems,
Right.
that might be more risky than the benefits of the fever itself.
Right. So it's kind of like a cost-benefit analysis,
Exactly.
whether it's worth it. We mentioned Dr. Martin Fleck,
Right.
and he had some thoughts on this. What was his take?
So Dr. Fleck, who's from the University of Regensburg, he's pretty critical of how quickly we tend to prescribe antipyretic medication,
Okay.
those drugs that lower fever.
Right.
He thinks it's become kind of an automatic response, when somebody has a fever.
Yeah.
But he says this might actually make infections last longer.
Really?
Yeah, because it's interfering with the benefits of the fever.
Huh. That's interesting.
And he believes that lowering the temperature is often unnecessary, and if you're uncomfortable, he suggests trying things like cool calf wraps,
Right.
before you jump to medication,
Okay.
because you want to avoid those potential side effects from the drugs.
That makes sense. I mean, it's always good to try the least invasive approach first, right?
Yeah. And his general advice is to let the fever run its course
Okay.
rather than immediately trying to bring it down.
But he did say that there were some situations where lowering the fever might be a good idea, right?
Yeah, he did say that for people who have pre-existing conditions like a weak heart or kidney problems or lung conditions,
Okay.
lowering their temperature might be helpful because it reduces the strain on their circulatory system.
Right. Okay.
But he really emphasized that those are the exceptions, not the rule.
Mm-hmm.
And any decision to lower a fever in those cases should be made with a doctor.
Okay. So if we do decide to take something to lower a fever, how do those medications actually work? How do those antipyretics work?
So antipyretic medications, a lot of them are what we call NSAIDs,
Okay.
non-steroidal anti-inflammatory drugs.
Right.
And they work by reducing the production of prostaglandins,
Okay.
those signaling molecules we talked about earlier that help control your body's temperature set point.
Mm-hmm.
So common antipyretics you might be familiar with are paracetamol, also called acetaminophen,
Right.
acetylsalicylic acid, which is aspirin,
Yeah.
ibuprofen,
Yeah.
and then there's a medication called novominsulfin.
Okay. Now, I assume each of these, comes with its own potential side effects, right? Things we should be aware of.
Absolutely. So paracetamol, the main risk there, especially if you take too much of it or if you have liver problems, is liver damage.
Okay.
Aspirin can increase the risk of gastrointestinal ulcers and bleeding.
Mm-hmm.
Ibuprofen has potential risks for the kidneys and the heart, especially if you take it for a long time. And novominsulfin, while it's rare, it can cause something called a granulocytosis, which is a severe decrease in a type of white blood cell.
Okay.
So that makes you more vulnerable to infections. And it's really important to remember that all of these medications, they do have potential side effects.
Mm-hmm.
And those risks can increase if you take more than the recommended dose.
Right.
Like even with paracetamol, if you take too much, it can cause your liver enzyme levels to go up.
Okay.
And both aspirin and ibuprofen are, known to cause things like heartburn and stomach pain, nausea.
Right. So it sounds like, there's a trade-off here. You might get some relief from the fever, but you're potentially exposing yourself to some side effects.
Exactly. And what's interesting is that our sources actually questioned whether routinely suppressing fever is even beneficial.
Okay.
Because fever itself actually helps your immune system.
Right.
It helps those immune cells fight off the infection. So people often take these medications because they're afraid of the fever or they just want to feel better.
Mm-hmm.
And while it might make you feel better temporarily,
Right.
there's more and more evidence suggesting that it doesn't necessarily mean you'll recover faster.
Wow.
And in some cases, it might actually slow down your body's natural healing process.
Huh. That's really interesting. Our source material mentions some specific studies about this, doesn't it?
Yeah. So there's a study that found that giving paracetamol to children with malaria actually delayed their recovery from the illness by about 16 hours.
Wow. Okay.
And then there were some Scandinavian studies that showed a connection between having a fever and lower mortality rates.
Right.
Yeah, and the people who had the highest fevers actually had the best survival rates.
Wow. That's counterintuitive.
Yeah, it is. And then on the other hand, there was another study that found that paracetamol didn't reduce the risk of death in a different group of patients.
Okay.
So it's complex. Our body's response to infection and whether or not we should routinely use these medications is something that's still being debated.
Right. So with all this in mind, when should we actually be concerned enough about a fever to, to go see a doctor? Is there like a specific temperature that we should be worried about?
So there's not one hard and fast rule for everyone,
Okay.
but generally, doctors recommend that you consider seeing a doctor if your temperature goes above 39 degrees Celsius.
Okay.
And you should definitely see a doctor if it's 40 degrees Celsius or higher.
Got it.
Mainly because there's a small risk of heart problems at that high temperature.
Okay.
And a very high fever can also sometimes be a sign of a more serious medical condition.
Right.
Like if you've recently traveled to a tropical region and you develop a high fever, it could be something like malaria or Ebola.
Right.
And in those cases, you need to see a doctor right away.
Yeah, absolutely.
And make sure you tell them about your recent travel.
Yeah, and what about more, common illnesses we might encounter, here at home?
So even in non-tropical regions, a high fever can be a sign of things like pneumonia or kidney infections or severe flu. But ultimately, whether or not you should see a doctor shouldn't just be based on the number on the thermometer.
Okay.
You also need to pay attention to other symptoms and how you're feeling overall.
Right.
For example, if you have a high fever that lasts for more than 2 days, especially if it comes with things like painful urination or pus, that could be a bacterial infection that needs antibiotics.
Got it.
But a lot of viral infections, even if they cause a high fever, will usually go away on their own without needing any specific medications.
Right.
And antiviral drugs only work for certain types of viruses anyway.
Yeah, that makes sense. So it's really about looking at, the whole picture.
Absolutely.
Now, fevers in babies and young children, that's always a big source of anxiety, right, for parents. Are there different guidelines for kids?
Yeah. And it's understandable why parents worry.
Yep.
Infants and young children do tend to get fevers more often than adults.
Okay.
And that's mainly because their immune systems are still developing.
Right.
It's not unusual for a child under 3 to have as many as 12 infections a year.
Wow.
As their bodies are learning to fight off all these different pathogens.
Right.
And so this naturally makes parents more likely to seek medical advice because they're worried about their child.
Yeah, absolutely. So when should parents, really be concerned and take their child to the doctor?
So for infants under 3 months old, it's generally recommended that you see a doctor for any temperature of 38 degrees Celsius or higher.
Okay.
Because their immune systems are still so immature.
Right.
And those infections can spread really quickly in their little bodies.
Okay.
For babies older than 3 months, the usual threshold is 39 degrees Celsius or higher.
Okay.
But regardless of the child's age, you should definitely seek medical advice if the fever is accompanied by things like, persistent diarrhea, repeated vomiting, or severe abdominal pain.
Right.
Because those can be signs of a more serious infection in the gut.
Okay.
And the important thing for parents to remember is that the goal of seeing a doctor is to find out what's causing the fever and to make sure the child is doing okay overall.
Yeah.
It's not just about lowering the temperature.
Right. You mentioned something called 3-day fever. What is that exactly?
So 3-day fever, also called roseola infantum, is a very common viral illness that affects infants and toddlers.
Okay.
And it's characterized by this sudden high fever that usually lasts for 3 to 4 days.
Okay.
But then after the fever goes away, a rash appears on the child's body.
Okay.
And it's usually flat and pink, and it disappears within a few days without needing any treatment.
Okay.
Now, other childhood illnesses like measles, rubella, chickenpox, and scarlet fever can also cause rashes.
Right.
But those rashes often look different, and they come with other symptoms. 3-day fever is caused by a droplet infection with human herpes virus type 6.
Okay.
And it's generally considered a harmless illness. Once a child has had it, they usually have lifelong immunity.
Oh, okay.
But it's interesting that if adults get infected with this virus, they might not get the rash, and they might just have more general flu-like symptoms like a runny nose and a sore throat.
Okay. What about fever related to ear infections? Because I feel like those are incredibly common in little kids.
Yeah, middle ear infections are really common in infants and young children, and they often do come with a fever. And these infections usually happen when a virus from a common cold spreads to the middle ear.
Right.
And it causes inflammation and fluid buildup.
Yeah.
So common signs are ear pain, which can be very intense, and a temporary decrease in hearing.
Okay.
And in some cases, the pressure in the middle ear can actually cause the eardrum to rupture.
Oh, wow.
Which is called tympanic membrane perforation.
Okay.
And that can actually relieve the ear pain.
Really?
Yeah. And those small tears in the eardrum usually heal on their own.
Wow.
But if it's a larger perforation, you might need to see a doctor.
Okay.
And infections of the outer ear canal are less common than middle ear infections.
Okay.
But they're also more frequent in children.
Okay.
And part of the reason is that the eustachian tube,
Mm-hmm.
which connects the middle ear to the back of the throat,
Right.
it's shorter and more horizontal in children, so it's easier for bacteria to travel up into the ear.
Okay.
And it's also interesting, some sources suggested that frequent ear infections or respiratory infections in kids might be related to food intolerances,
Really?
like milk protein or other things.
Wow. Okay.
So it might be worth trying an elimination diet if your child has a lot of these infections.
That's really interesting, that possible connection there between food and ear infections. Now, the article also briefly mentions rheumatic fever.
Right.
That sounds serious.
Yeah, rheumatic fever is a condition that mainly affects children and adolescents between the ages of 3 and 16,
Okay.
and it's an autoimmune disease. It's quite rare now in developed countries,
Okay.
but unfortunately, it's still a leading cause of heart disease in children in developing nations.
Wow.
And rheumatic fever can happen after an untreated strep throat infection.
Oh, okay.
And what happens is the body's immune system, it attacks the strep bacteria, but it can mistakenly attack the body's own tissues as well.
Oh, wow.
And this causes inflammation in different parts of the body, like the joints, the lining of the heart, the skin, and even the nervous system.
Wow.
So symptoms of rheumatic fever can include fever, joint pain and swelling, chest pain, a rash, and sometimes even these uncontrolled jerky movements.
Wow. That's a lot. And what about, the age-old question, does teething actually cause a fever in babies?
Teething can sometimes cause a slight increase in a baby's temperature,
Okay.
but it's usually very mild. It's usually below 38 degrees Celsius.
Oh.
So if a teething baby has a higher temperature than that, it's more likely to be a sign of an infection, not just the teething itself.
Oh, okay. So that's good to know. Another thing that can be pretty scary for parents to see is febrile seizures. What exactly are those?
So febrile seizures are seizures that happen in young children when their temperature rises really quickly.
Okay.
And they can look a lot like epileptic seizures.
Mm.
The child's eyes might roll back. They might have twitching or jerking movements. They might lose consciousness for a short time, and they might go limp.
Yeah.
And while it's really frightening for parents to see,
Absolutely.
it's important to know that these seizures usually only last for a few seconds to a few minutes, up to about 5 minutes.
Okay.
And they're generally considered harmless.
Okay.
They don't usually cause any brain damage.
That's good to know.
So during a febrile seizure, the most important thing for parents to do is to try to stay calm, protect the child from injury by, clearing the area around them and make sure they can breathe properly.
Okay.
And after a febrile seizure, you should always take the child to the doctor to see what caused the fever.
Okay.
And although febrile seizures are often linked to common childhood illnesses like 3-day fever or gastrointestinal infections,
Right.
doctors might recommend an EEG, which is a test that measures the electrical activity in the brain,
Okay.
just to rule out other causes like meningitis.
Okay. So better safe than sorry in that situation.
Exactly.
Now, the source material even touches on the topic of using homeopathy to manage fever. That's an interesting angle.
Yeah. So while homeopathy isn't officially recognized by, mainstream science, because there's not a lot of strong scientific evidence to support it,
Right.
there are some doctors who do use homeopathic treatments alongside conventional medicine.
Okay.
So, for example, Dr. Margaret Yeager, who's a pediatrician, is mentioned in our sources as someone who uses both homeopathy and conventional medicine to treat fever in children.
Okay.
And she reportedly recommends a homeopathic remedy called belladonna in a specific dilution and dosage for kids with fevers above 39 degrees Celsius.
Okay.
But she also emphasizes that if the child's temperature doesn't come down, or if they're getting worse, you should still use conventional medications like ibuprofen,
Right.
because those can also help the child feel better and rest.
Yeah.
And for fevers below 39 degrees Celsius, especially if the child isn't in any pain, she generally doesn't recommend using antipyretics.
Okay, so it's kind of like a complementary approach.
Right.
Using both. What about when we see a slightly elevated temperature after vaccinations? That's something that a lot of parents, will notice.
Yeah, fever and In some rare cases, even febrile seizures can happen after certain vaccinations.
Okay.
Like the DTaP IPV Hive HBV combination vaccine. That can happen within 24 hours of getting the shot.
Okay.
Or the MMR vaccine, which is for measles, mumps, and rubella. That can cause a fever about 8 to 14 days after the vaccination.
Okay.
And this is basically a normal reaction to the vaccine. Vaccines work by introducing a weakened or inactive form of a virus or bacteria into your body. And that allows your immune system to learn how to recognize and fight off the real thing if you encounter it later on.
Right.
And so this learning process triggers a mild immune response, which can sometimes include a low-grade fever. And it's actually a sign that your body is responding to the vaccine and building up.